Thanks, everybody. My name is Sharon. I'm an independent infection prevention consultant, and I'm a paid consultant for Metrex. Let's see if my slides will advance. Thanks for joining me for Viruses Gone Wild. Who's partying? To get in the mood, I wore my cocktail hour shirt. The objectives for today are to explain what viral respiratory season is. We'll talk about what's been circulating recently and look at different viruses, their symptoms, incubation periods, and discuss ways to protect yourself. According to the CDC, a lot of people in the US started the new year off ill. Before COVID-19, only two viruses were the main causes of severe respiratory disease in fall and winter: influenza and respiratory syncytial virus, RSV. Now, if you got sick this season, it could have been a cold, but a trio of respiratory illnesses, influenza, RSV, and COVID-19, were also on the rise. The CDC reported from January to February of 2025, the amount of acute respiratory illness causing people to seek health care was at a high level. Currently, we're at a moderate level. Did that tridemic return, or did it never leave? Respiratory illness is now monitored using the Acute Respiratory Illness Metric, ARI, for respiratory illnesses from the common cold to severe infections like flu, RSV, and COVID-19. It captures illnesses that might not present with fever, giving a more complete picture than the previous influenza-like illness metric, that ILI metric. The ARI metric shows respiratory illnesses were on the rise, and you can see from the maps that respiratory viral illness was pretty active nationwide. In January, things started to pick up. Activity levels in February rose to very high in some states, and as of March 8th, ARI metrics were looking like they were declining. So what was going on? Is this unusual virus activity? Have viruses gone wild? Should we be worried? If it felt like a lot was circulating at the same time, it actually was. COVID-19, RSV, and especially flu were pretty active. During COVID-19, we learned a lot about wastewater activity. Wastewater sewage can be tested to detect traces of infectious diseases circulating in a community. Now, people with certain infections could shed pieces of viruses when using the bathroom, showering, or washing clothes, even if they don't have symptoms. Testing wastewater helps us track infection levels in the community, including when people aren't going to the doctor. These data can be used as an early warning that levels of infections may be increasing or decreasing in a community. Wastewater activity can't determine the source of viruses, whether it's humans or animal products, but high wastewater levels could indicate an increased level of infections, even when other measures remain low, like the number of hospitalizations or test positivity. Now, these maps show wastewater activity for flu, RSV, and COVID-19. And I think it's fascinating how you can see viral activity changing in sewage. Thank goodness we have the CDC to track all of this for us for now. Just when you thought we had enough with flu, RSV, and COVID-19 circulating, norovirus, known commonly for causing acute gastroenteritis and not a respiratory virus, was also on the rise, causing outbreaks across the country. A record 91 outbreaks were recorded for the week ending December 5th, 2024, far more outbreaks than in recent years at this time. These four viruses, COVID-19, flu, RSV, and norovirus, all of them highly contagious, were circulating at high levels this season. This created what experts were calling a quad-demic in the US. Fall and winter are a time when viruses that cause respiratory disease usually circulate more heavily in the community, and this period is typically referred to as respiratory virus season. The infections circulating during respiratory virus season can be as minor as the common cold or as severe as a bad case of pneumonia. Respiratory virus season typically starts around November and peaks in January or February and ends in late March or early April. Some seasons are more severe than others based on strains of viruses circulating and our immunity to these viruses. The different viruses can arrive in waves, surging at different points throughout the fall, winter, and early spring. Now, to be clear, you can contract respiratory illnesses at any time of the year. A few factors that contribute to viral seasonality that we know of are the temperature dropping, because viruses can be picky, especially when it comes to climate. Many of the viruses circulating during respiratory virus season are RNA viruses, and RNA degrades with heat. That's why cold weather is preferred by many viruses. Spending more time indoors. When we're indoors more often, especially in close proximity to others, we're more likely to spread germs due to closed windows and warm, dry air. Low humidity indoors causes dry nasal passages, which are more susceptible to viruses. Children and students returning to daycare and school. They are vectors for any number of respiratory infections. They aren't great at washing their hands, covering their coughs, or keeping their germs to themselves. And we send them back to crowded classrooms, dorms, and daycare facilities right as viruses start surging. These factors contribute to viral seasonality, especially RNA viruses. Now let's take a look at some of the viruses that were circulating and causing illness. Influenza. Influenza or the flu is a common respiratory illness you get from the influenza virus. Influenza A, B, and C are the most common types that infect people. Influenza A and B are seasonal, and most people get them in the winter and have more severe symptoms. Influenza C doesn't cause severe symptoms, and it's not seasonal. The number of cases stays about the same throughout the year. Flu A is generally more severe and is the only variant known to cause pandemics, including the 1918 flu pandemic. H1N1 swine flu and H5N1 bird flu are both subtypes of flu A. The flu is one of the most common infectious diseases. In a typical flu season, it's estimated that between 20,000 to 50,000 people die in the US. The flu is contagious, it spreads from person to person, and flu can last from a few days to a couple of weeks. People with weakened immune systems and infants may be contagious for even longer. Now, what's the difference between the flu and the common cold? Well, they both have similar symptoms like runny nose and cough, but cold symptoms are usually mild and flu symptoms can be severe and they can lead to serious complications. Flu or COVID-19, how do you know which one you have? You don't. The only way to know for sure is to get tested. Some of the flu symptoms are listed here on the slide. Symptoms like fever and body aches can come on suddenly, but usually go away faster than the other symptoms, and a cough or runny nose can last longer. So who's at higher risk for complications from flu? It's a pretty long list. People with asthma, COPD, or another chronic lung disease, a history of kidney, liver, neurological, heart, or blood vessel disease, including stroke, a condition that causes issues with muscle function or makes it difficult to cough, swallow, or clear fluids from your airways, diabetes, a weakened immune system, a blood disorder like sickle cell disease, BMI greater than 30, being under 5 years old or over 65 years old, are pregnant, live in a long-term care facility. Now, how many knew this? Non-Hispanic Black people, non-Hispanic American Indians, Alaska Native people, and Hispanic or Latino people have the highest rates of severe illness from the flu compared to non-Hispanic white and non-Hispanic Asian people. Flu is considered a vaccine-preventable disease, and it's treated with antivirals like Tamiflu. After a moderate flu season last year, flu has returned with a vengeance. This flu season is now the most severe season in the US in 15 years. As a comparison, the overall burden of flu from the 2022-23 season was estimated at about 31 million flu illnesses. The 2024 flu season burden is estimated to be between 41 and 71 million illnesses. Now, CDC estimates there have been at least 23,000 deaths from flu so far this season, 134 of them pediatric. A few facts to know about this flu season. Flu is classified as high severity for all age groups for the first time since the 2017-2018 season. For the first time since the beginning of the pandemic, more people in the US died of flu than from COVID-19 for the week ending January 25th, 2025. And flu hospitalizations have also surpassed those for COVID-19 for the first time since the pandemic. H1N1 and H3N2, both type A flu strains, are the predominant flu viruses circulating this season. Now, the current vaccine was engineered to protect against both of these variants and one influenza type B strain. So how effective is the flu vaccine for this 2024-25 season? For children and adolescents under 18, it's about 63 to 78% effective against hospitalization. For adults 18 and older, it's 41 to 55% effective against hospitalization. And it typically ranges from about 40 to 60% every season. Even if flu vaccine effectiveness dips below this range in a given year, it still offers essential protection that can keep you from getting seriously ill. So what's contributing to this 15-year high in flu activity? Could the increase be due to the flu virus constantly evolving and the circulating strains more virulent or resistant to our existing vaccines? Or could it be because people have become more comfortable being in large groups and small spaces again? Or some parts of the country have an unusually cold winter, both with people indoors, increasing close contact, and making it easy for the virus to spread? Or could it be something else? This chart shows flu deaths compared to those from the past flu seasons. Our flu season has peaked. However, flu-related medical visits, hospitalizations, and deaths remain elevated, and the CDC expects several more weeks of flu activity. Let's hope things start to slow down even faster. Respiratory syncytial virus, RSV, is a virus that can lead to respiratory infections in babies, children, and adults of all ages. It's called syncytial because it causes infected cells to fuse together into syncytia, which are large cells with many nuclei. RSV is very contagious. Most people develop mild cold-like symptoms 4 to 6 days after exposure, and the symptoms usually clear up within 1 to 2 weeks, but that cough can linger in a mild form for several weeks after the initial infection. RSV is the leading cause of infant hospitalization, but many fewer infants die from RSV compared to older adults. People most at risk for severe illness are babies that are born early, children under 2, and children with underlying conditions like congenital heart disease or a compromised immune system, adults over 65, and adults with chronic lung conditions like heart disease or a compromised immune system. The common symptoms are listed on the slide. Now, there isn't a specific treatment for RSV in children or adults. Antibiotics aren't effective, so treatments are typically what you'd use for a cold. RSV is considered vaccine preventable. The CDC recommends RSV vaccines for adults 75 and older, as well as those between 60 to 70 years old who are at increased risk of severe disease. There are also specific vaccine recommendations for pregnant women, infants, and babies, and I've included them in the resource section at the end of this presentation. RSV surged in nearly all populations, but it was highest in children, and hospitalizations were elevated among older adults in some areas. Recent RSV seasons have caused the numbers in older populations to increase nearly tenfold, with about 15 out of every 10,000 people older than 50 being hospitalized for their RSV infection. People who live in extended care facilities, nursing homes, assisted living communities, or hospitalized patients are at a 30% higher risk of RSV. And these populations specifically are at higher risk for developing long-term complications and other conditions like pneumonia, asthma, and COPD. Now, we don't know the exact numbers of people who were sick from RSV because not everyone seeks care or gets tested. Is there a new strain of RSV? One study suggests recent surges of it have been driven by multiple lineages of the virus. RSV activity has peaked in many areas of the country. You can see that on the map, and is declining in some areas, but it's still very high in some states. We're not done with it yet. We also saw COVID-19 caused by the SARS-CoV-2 coronavirus partying with flu and RSV. Now, coronaviruses are a family of viruses that can cause respiratory illness in humans, and they're called corona because of those crown-like spikes on the surface of the virus. Severe acute respiratory syndrome, SARS, Middle Eastern respiratory syndrome, MERS, and the common cold are examples of coronaviruses that cause illness in humans. COVID-19 causes respiratory symptoms that can feel much like a cold, the flu, or pneumonia. And in about 80% of people, it causes only mild symptoms, but some people become severely ill. The risk factors for severe illness are people 65 and older, immunocompromised, have certain disabilities, or have underlying health conditions. Some people, including those with minor or even no symptoms, will develop post-COVID conditions, also called long COVID. Now, it spreads when an infected person breathes out droplets in very small particles that contain the virus. The virus then enters your body through your mouth, nose, or eyes, directly from those airborne droplets, or from the transfer of the virus from your hands to your face. It then travels to the back of your nasal passages and mucous membranes in the back of your throat and attaches to cells there. It begins to multiply and it moves into lung tissue. From there, it can spread to other body tissues, causing other parts of your body to become affected by the disease. Anyone infected with COVID-19 can spread it, even if they do not have symptoms. Pets worldwide, including cats and dogs, have been infected with the virus, mostly after close contact with people with COVID-19. It is considered vaccine preventable. COVID-19 activity was elevated in many areas of the country. ED visits and hospitalizations were highest in older adults, but also elevated in young children. The graph shows COVID deaths from January 2020 to March 2025. In August of 2024, COVID deaths started to increase with over 1,300 deaths by the end of the month. September through November, we saw some decline. From November until January, things picked up. And on January 11th, we saw over 1,000 deaths. Now, since then, the number of deaths have continued to decline, and the week of March 8th saw 253 deaths. It's not possible to know the exact number of people who were sick from COVID-19 because not everyone who gets sick is seeking care or being tested. Also, COVID-19 is no longer a nationally notifiable disease, meaning cases are no longer reported to the CDC. So they can't identify all the illnesses in the United States. So what the CD does is it calculates an estimate of the burden of COVID-19 on the US population, and you can see that on the slide. People still die from it, just not at the alarming numbers we've seen in the past. Now, there's still time to get vaccinated to reduce severe illness and hospitalization, and the CDC expects the current vaccine to work well against circulating variants. So with all this other stuff that's been circulating, a new coronavirus that could cause another pandemic was discovered in China, named HK-U5-CoV2, identified in a bat. It's a virus that uses the same receptor as SARS-CoV-2, the virus that causes COVID-19. So this really raises some concerns about potential animal to human transmission. This is another virus to keep an eye on. Our next virus that was circulating with flu, RSV, and the COVID-19 party was norovirus. Norovirus is a highly contagious virus that can cause repeated bouts of vomiting and diarrhea. It causes about 58% of foodborne illness in the US, and you'll find outbreaks in food service settings like restaurants where ready-to-eat foods such as fresh fruit, leafy greens, and shellfish like oysters are served. Over half of all norovirus outbreaks reported in the United States occur in long-term care facilities, and outbreaks in these settings can sometimes last for months. Now, norovirus illness can be more severe and occasionally even deadly in patients in hospitals or long-term care facilities. Outbreaks also frequently occur in schools, childcare centers, colleges, and universities. Norovirus is the most frequent cause of outbreaks of diarrheal illness on cruise ships, over 90%. It's those closed quarters, the shared spaces, and high-touch surfaces that make it easy for it to spread in all of these settings. You can get norovirus many times in your lifetime because there are many different types of noroviruses. Infection with one type may not protect you against other types. This might explain why so many people of all ages get infected during norovirus outbreaks. It can persist on surfaces for days or weeks and is resistant to many common disinfectants. In healthcare, it's recommended to use an EPA-approved product for disinfection of norovirus from the EPA List G. At home, a 1 to 10 bleach solution can be used. Norovirus is a hardy virus with a thick capsule that protects it from alcohol-based hand sanitizers. So alcohol-based sanitizers aren't effective. You're going to need to use soap and water to remove it. And it's the friction created by washing your hands with soap and water that removes the virus particles from your skin. It doesn't kill norovirus. It just reduces the number of virus particles on your hands. In January, norovirus surged to levels not seen in more than a decade, with rates still high in some areas. A record 91 outbreaks were recorded for the week ending December 5th, 2024, far more outbreaks than in recent years at this time. Cases in November and December more than doubled across the country over that same period last year, aided by a new strain of virus. And in years where there's a new strain, like this year, there can be up to 50% more norovirus illness. During August 1st, 2024 through February 5th, 2025, there were over 1,600 norovirus outbreaks. As a comparison, during that same period last year, there were only 729 outbreaks. The quad-demic of influenza, RSV, COVID-19, and norovirus really took off after the holidays, but these weren't the only viruses rearing their ugly spiked proteins. How about H5N1? It was first identified in domestic waterfowl in southern China in 1996, and the first known outbreak in humans occurred in Hong Kong in 1997. Illnesses in humans have ranged in severity from no symptoms or mild illness to severe disease that resulted in death. Human infection happens when the virus gets into a person's eyes, nose, or mouth, or is inhaled, or when a person touches something that has the virus on it, then touches their eyes, nose, or mouth. That's direct and indirect contact. The spread of avian influenza viruses from one infected person to a close contact is very rare, and when it's happened, it hasn't led to continued spread among people. This virus is more readily transmitted from poultry to people. Human infections with it have most often occurred after close or lengthy unprotected contact with infected birds, or in places that sick birds or their saliva and mucus and feces are, and they have been touched without wearing any kind of gloves or respiratory or eye protection. Very rarely, human infections with avian flu have happened through an intermediary animal, including a cat and a cow. Outdoor cats on U.S. dairy farms have been infected with the virus, but infection has been not reported in indoor cats. Symptoms begin within 2 to 8 days after exposure, and one symptom that really makes it stand out is eye redness, irritation, or eye discharge. And this is more commonly reported with human infections with animal influenza viruses than seasonal influenza viruses. Treatment primarily involves antivirals like Tamiflu, which are most effective when they're started soon after symptoms appear, ideally within 48 hours. H5N1 is not vaccine preventable. Since April of 2024, the CDC has confirmed bird flu in 70 people in the United States, and the majority of confirmed cases were associated with exposure to infected animals, including poultry and dairy cows. 3 U.S. cases in humans with no known exposure to infected animals have been identified, but the majority of cases have been among people who have close contact with animals. In 2025, the CDC confirmed 3 human cases of bird flu, a dairy worker with exposure to infected cows, a poultry worker with exposure to infected commercial poultry, and the owner of an infected backyard poultry flock. Now, these are all considered high-risk exposures. The dairy worker wasn't hospitalized, but both poultry exposures resulted in severe illness, and both of those people were hospitalized. There was also a man in Louisiana who was hospitalized and died after exposure to backyard chickens and wild birds. CDC believes the immediate risk to the general public is low, but this risk assessment could change because influenza viruses constantly change. This is another one to keep an eye on. There's something else you might have heard circulating lately. Some people think of measles as just a little rash and a fever that clears up in days, but measles can cause serious health complications, and especially in kids younger than 5. Measles sends the immune system into shock, destroying critical cells that help our bodies respond to threats. This can lead to a condition called immune amnesia, where the body's immune system loses its memory of previously encountered pathogens, making the body unable to defend itself against illnesses it's already been exposed to, leaving people more susceptible to future infections. Everyone who gets sick from measles will experience some level of immune amnesia. For some people, it might mean if they get the flu, they'll have to spend an extra day or 2 in bed, but for others that lose far more immunity, they can get seriously ill from the viruses they'll encounter. Now, research indicates that this immune suppression or amnesia can last for around 2 to 3 years after a measles infection, and it can take up to 5 years to regain your pre-measles level of immune memory. Dr. Erin Millstone, a pediatric infectious disease specialist at Johns Hopkins Children's Center, said the real concern is a child is not just going to get measles and get sick, but within the next couple of years, that child is going to be extremely vulnerable to a lot of other viruses. About 1 out of every 20 children with measles develops pneumonia, which is the most common cause of death. Even in children who survive, a severe case of pneumonia can impair lung function in the long term. The illness can scar the lungs, making it difficult to breathe properly. Children who develop pneumonia from measles may also be more likely to develop asthma and COPD as adults. Measles can also cause severe long-term complications. About 1 in 1,000 children who get measles will experience brain swelling, which can cause hearing and vision loss, intellectual disabilities, and permanent brain damage. And people of any age who are immunocompromised are at a greater risk for developing a specific type of brain swelling called measles inclusion body encephalitis that can occur for up to a year after recovery. In extremely rare cases, adults and children can develop subacute sclerosing panencephalitis, a fatal disease of the central nervous system. It can cause seizures, and it typically appears about 7 to 10 years after a patient has recovered from the measles. There is no cure for this. Some estimate between 4 and 11 per 100,000 cases of measles can lead to this condition, and that risk is slightly higher among children who are infected under the age of 5. Measles is also dangerous for pregnant women who are more likely to become hospitalized and develop pneumonia. They are also at a heightened risk for miscarriage, preterm birth, and stillbirth. Measles can spread to others through coughing and sneezing, and it can live up to 2 hours in an airspace and on surfaces after that infected person has left the area. If other people breathe the contaminated air or touch a contaminated surface, then touch their eyes, nose, or mouth, they can become infected. If one person has it, up to 9 out of 10 people nearby will become infected if they aren't protected, and an infected person can spread measles to others even before knowing they have the disease. Some of the symptoms are listed on the slide. Measles is not a seasonal virus. However, measles is often spread over times of high travel, like spring break, or in situations where unvaccinated persons are in close quarters, like summer camp or school. Measles is considered vaccine preventable, and the best protection against measles is the measles, mumps, and rubella vaccine. 2 doses of MMR are 97% effective at preventing measles. 1 dose is about 93% effective. The vaccine provides long-lasting protection against all strains of measles. Before the measles vaccine was introduced, between 400 and 500 people died in the United States each year. Measles was officially eliminated in the US in 2000, a historic public health achievement. Elimination meaning there were no measles spreading within the US, and new cases were only found when someone contracts measles abroad and returns to the United States. Now, the graph on the left shows how common measles were before vaccines and how vaccine policy enabled elimination. The bar graph on the right shows the number of measles cases from 2000 to the present. We're currently at 301 cases. The measles outbreak in West Texas that began in late January is the largest measles outbreak in 30 plus years and continues to grow, with more than 300 people infected, many unvaccinated school-age kids. 95% of the cases have been in people who are unvaccinated or have unknown vaccination status, and the majority of the cases are in people between the ages of 5 and 17 years old. Now, the map on the left shows measles cases currently reported in 16 states. The Texas outbreak began in Gaines County, a rural agricultural area, actually noted for low childhood vaccination rates, largely because of its large Mennonite community. Mennonites typically don't interact with the healthcare system very much, and they have a long tradition of using home remedies and supplements. So only about 82% of the kindergartner students in the county received the MMR vaccine last year, far below the 95% coverage needed to prevent outbreaks. Now, Texas public schools do require kids to have certain vaccines, including the MMR, but parents can apply for an exemption for reasons of conscience, including religious beliefs. Last year, Gaines County in Texas, where that outbreak began, had one of the highest exemption rates in the state. Lea County, New Mexico, where measles have spread, the MMR vaccination rate for children and teens is relatively high, about 94%, which is great, but the rate among adults is much lower. 63% received 1 shot, and only 55% received both shots. Adults make up more than half of the reported cases in that New Mexico outbreak. 1 death was reported in an unvaccinated school-age child in Texas. This was the first U.S. measles death since 2015, but it's not the only one. New Mexico reported an unvaccinated adult in Lea County also died. There were also exposures at 2 Texas universities, so probably plenty more to come as this measles outbreak spreads with spring break and travel happening. So who enforces vaccination? It's not the federal government. The CDC advises the public about vaccination, but it doesn't enforce vaccinations. States generally set policies, exemptions, and rules for enforcement. And since early 2020, at the start of the pandemic, immunization rates in the United States have fallen in most states, and unfortunately, they continue to decline. When more than 95% of people in a community are vaccinated, most people are protected through community immunity or herd immunity. In recent years, MMR coverage among kindergartners is now below that 95% coverage target and much lower in some communities and is decreasing. And this decline doesn't only apply to measles. Polio and whooping cough, Bordetella pertussis vaccinations have also declined. Also, global measles activity is increasing, meaning more chances of an unvaccinated person infected with measles abroad returning to the United States. This was the scenario in the February 19th case of an Orange County, California resident returning from Asia. So, what's with all the falling vaccination rates? Well, as the pandemic strained trust in the public health system, more families of kindergartners formally opted out of routine vaccines, citing medical, philosophical, or religious reasons. And others simply didn't submit proof of a complete vaccination series for any number of reasons, falling into the non-compliance category. Now, some have said that non-compliance to vaccine falls along political lines, and I'm not going to get into that. But I will mention that I read 31% of one political party say vaccines are more dangerous than the diseases they were designed to protect. Just 5% of another party say the same thing. Vaccination rate remains the best defense against measles infection. And if you'd like to see vaccination rates for your state or all 50 states, I've provided a link in the resources section at the end of this presentation that you can take a look at to do that. Not wanting to be left out of the party was human metapneumovirus, a common respiratory virus that causes cold-like symptoms. Now, human metapneumovirus and RSV are considered viral cousins that belong to the same virus family and are associated with similar symptoms and clinical outcomes. Human metapneumovirus can cause upper and lower respiratory disease in people of all ages, especially among young children, older adults, and people with weakened immune systems. It's so common that most people will be infected as children and experience several infections in their lifetime, but symptoms are usually mild after your first infection. Researchers estimate that about 10 to 12% of respiratory illnesses in kids are caused by human metapneumovirus. Most cases are mild, but about 5 to 16% of children will develop a lower respiratory tract infection like pneumonia. So young kids, older adults, and people with weakened immune systems are at a higher risk for a severe infection. Currently, there is no specific antiviral therapy to treat it and no vaccine to prevent it. During the 2024-2025 respiratory season, human metapneumovirus cases were on the rise. In January of 2025, there were reports of outbreak in several countries besides the US, including China and Japan. These outbreaks were mainly occurring during the winter months, which is the peak season for it, so not so much concern about an epidemic. The cases were affecting young children and older adults, so it's something to keep an eye on, but certainly nothing to panic about. I hope you remember that airy metric way back in the beginning of this presentation that monitored acute respiratory illness. The common cold was lumped into that metric, and we don't really know how many colds occur each year because most people don't seek care. We do know there are more than 200 different types of viruses that can cause a cold. The common cold is a contagious upper respiratory infection that affects your nose, throat, sinuses, and windpipe. We call colds common because they're so widespread, and you'll probably have more colds in your lifetime than any other illness. The most common cold virus is the rhinovirus, which causes up to 50% of common colds, and there are more than 100 different rhinoviruses. Colds spread easily from person to person by touching a surface or breathing moist air that contains the cold virus. Babies and children get as many as 8 to 10 colds a year, and this is mainly because they haven't been exposed to as many viruses as adults, and their immune system hasn't learned how to recognize and fight these viruses off. There is no cure for a cold. Most colds go away on their own within 7 to 10 days and don't turn into anything more serious, but some symptoms can persist. Some people develop a nagging cough that can last up to 2 months. So not only did we see viruses circulating, but also a bacteria. Mycoplasma pneumoniae is a gram-negative bacteria that can cause respiratory tract infections that are generally mild. It damages the lining of the respiratory tract, including the throat, windpipe, and the lungs. Most commonly, it can cause a chest cold, and less common, it causes pneumonia. Now, when M. pneumoniae infection progresses to pneumonia, it's typically a less severe form of bacterial pneumonia, and it's commonly referred to as walking pneumonia. Very young children usually have upper respiratory tract symptoms, and in older children and adults, they're usually lower respiratory tract symptoms. An estimated 2 million infections each year in the US occur. However, the true number is not really known because there's no national reporting or surveillance for this organism. It's spread by coughing and sneezing, which creates small respiratory droplets that can contain the bacteria, and other people can get infected if they breathe in those droplets. Outbreaks occur most commonly in crowded environments like schools, college residence halls, and nursing homes. And the outbreaks can be prolonged due to its long incubation period, which is between 1 and 4 weeks. Most will recover without medication, but some people need antibiotics to get better. So respiratory infections caused by M. pneumoniae have declined from their peak in late 2024, but still remain high nationwide, especially in young children. 2024 saw an increase from February through October among all age groups. You can see that on the graph, peaking in August and remaining high. The increase, however, was highest among kids ages 2 to 4 and children between 5 and 17 years old. Now, it's that increase in children 2 to 4 years old which is notable because M. pneumoniae historically hasn't been recognized as the leading cause of pneumonia in this age group. So we've looked at what was circulating this past fall until now, trying to understand why so many were sick. We learned that RSV, influenza, norovirus, and COVID-19, the quad-demic, were all partying at the same time. H5N1, human metapneumovirus, Mycoplasma pneumoniae, the common cold, and measles joined in. So what caused the prevalence of multiple viruses? Was it pathogens on an early spring break? Are viruses and even some bacteria going wild? According to the CDC, there's nothing to worry about regarding these respiratory viruses. The important takeaway is we aren't seeing any new viruses. The levels of these respiratory viruses did start increasing a little earlier than usual this winter, and that could have compressed all of the surges into January, making it seem like viruses were going wild. Norovirus showed up at the party because in 2025, a new strain began circulating and started surging in the US. But remember, according to the CDC, that's nothing new. In years when there's a new strain, there can be 50% more norovirus illness. Normally, there's a predictable pattern to seasonal respiratory viruses. They usually ramp up in late fall or early winter and decrease by spring or summer. But COVID-19 caused a phenomenon called the immunity gap. An immunity gap can develop when your immune system essentially gets a break from being exposed to a mix of common pathogens, bacteria, viruses, and other microorganisms that can cause illness. The measures that help keep us safe from COVID-19, physical distancing, wearing masks, washing our hands, caused a significant decrease in non-COVID respiratory infections in both children and adults and helped limit viral spread. This reduced level of immunity this reduced our level of immunity in the population, and now widespread COVID protective measures are no longer in place. These viruses are circulating again, infecting a vulnerable and non-protected population. So as a result, more infants, children, and adults are getting sick in higher numbers and earlier than expected. Also, the population of people older than 60 is larger now than it's ever been before, and we have now more immunocompromised people than before. The immunity gap changed the seasonality of some of these respiratory viruses, causing them to appear later than expected and in greater numbers. And it's unclear if people who get these viruses now will become sicker due to that immunity gap, but immunocompromised individuals and the elderly are most at risk. Measles uptick is another story, mainly about decreasing vaccination rates because it's not a seasonal virus. How about we prevent and avoid spreading infections by taking some simple steps? Vaccination, especially for vaccine preventable diseases. I cannot stress this enough. Most of what we looked at today are vaccine preventable diseases. Advocate for vaccinations. This is how we enhance public awareness of the significance of vaccination, elevate the level of herd immunity, decrease the number of susceptible individuals, and mitigate the spread of diseases. Vaccination is a safe, highly effective, and easy way to help keep you and your family safe. Vaccination is the best way to prevent certain diseases, especially in children, like measles, polio, and whooping cough. But adults also still need vaccines to prevent some illnesses too. Everyone needs to stay up to date on vaccinations. Please remember, no vaccine is 100% effective, but it can significantly reduce the risk of infection, complications, and death. We should implement hygiene practices like hand washing, which is one of the easiest and best ways to protect yourself from most infections. Use soap and water if your hands are visibly dirty. Use an alcohol-based hand rubs if your hands are clean, but not for norovirus, because it's not effective at removing it. You'll need that mechanical action of scrubbing your hands with soap and water to remove it, not kill norovirus. And don't forget to dry your hands, because damp hands are 1,000 times more likely to spread bacteria. At least wash your hands before making or eating food, after changing a diaper, or after using the toilet. We should implement respiratory hygiene, cough etiquette. This simply means covering your mouth and nose when coughing or sneezing with a tissue, your sleeve, or your elbow, not your hand. Avoid touching your eyes, nose, and mouth, and wash your hands. We should clean and disinfect frequently touched surfaces and items. Ideally, clean a surface first using mechanical scrubbing before you disinfect. In healthcare, you must use an EPA-registered hospital disinfectant following those manufacturer's instructions for use. Now, most of the viruses we talked about are enveloped, so they're fairly easy to kill. Think of the Spalding pyramid of organism resistance. I've included it in the resource section. We should apply public health interventions, wearing masks, social distancing, making sure there's proper ventilation, staying home when sick. They all play a crucial role in preventing common infections and managing seasonal epidemics. These are the measures that help keep us safe from COVID-19, and we saw a significant decrease in non-COVID respiratory infections, and we limited viral spread. Let's use some of those again. Health education and pathogen monitoring. Health education is how we teach people about viruses and bacteria across all age groups, helping them to learn how to protect themselves. Knowledge is power. Keep it simple and just the facts. Step away from the cod liver oil. Pathogen monitoring can help identify the onset of seasonal epidemics early on. This is how we prepare for what's coming, big or small, so we can protect ourselves and others from getting seriously ill. This respiratory virus season has been a wild one. Chances are you or someone you know has been sick with something. Now you know more about who's been partying and what you can do to keep yourself and others from joining their party.